Welcome, everyone, back to the bar tonight. It's already been a long week, but we are proud to be here. Can't wait. We have the incredible Dr. David Lindemann on deck tonight. We have so much to talk about. Let's go. David, what is up? Welcome to the bar. How are you in Kentucky?
It's good to be here. Doing well and happy to be with you.
Man, I'm pumped. One of the things that we always start out with that's so important to us is we'd like to talk about and highlight a charity. And to do so, in that process, we like to do a cheers to charity. So I can't wait to hear what drink you are drinking tonight.
So on the alcoholic side, in tribute to my home state, a little bit of Elijah Craig.
Nice.
Neat and simple as I like it. So
nice, man.
And hopefully for our audience, a little shot of hope, encouragement, and some water on the side.
I like it, man. I like it. I'm actually going with what is now my favorite end of summer drink ever, which is called a Sylvain Summer. And in a Sylvain Summer, it actually takes a little bit of effort. It takes one fresh lime, one fresh lemon, half of an orange, and then you need 1.5 ounces of Pimm's. So Pimm's is a liqueur that's from England. It's a couple hundred years old. And then you top it off with a little bit of a pale ale. And it is something to behold. I mean, it is something, my man. It is something. So this will be a great show. Man, I would like for you to talk about the charity that you are so kind enough to be able to donate to tonight so we can bring awareness to tonight.
Yeah. So the charity I chose was one that's close to my heart professionally and personally. A charity local here to Kentucky, but across the nation, called Refuge for Women. I personally have worked with a huge number of sexual assault victims, and a great privilege to see them heal and whole. And Refuge for Women actually helps women out of sexual trafficking. And what's amazing to me, we both have a heart for people, but also for results. And so when you look at two things, one, it's extremely practical. So they understand there's real needs that are not superficial. But number two, they're looking at somewhere around 70% success rates, which is absolutely mind-blowing when you're looking at what these women are coming out of to be able to return to happy and healthy lives. And so a salute to them, thankful for all of their work, and God bless them in it. I'm really thankful for it. So
just talk about our sponsor tonight, Active Spine and Joint Center, who sponsors the most and does the most that they can to help local individuals suffering from pain, discomfort, the big bias towards finding out the root cause of what is causing someone's pain and how to help them. Man, take me a little bit. I really think people just need to go on your journey and just understand how you got to where you are. I would love for you to start either in medical school or in your military experience, and just start there. And let's just dive into your amazing career so far and everything you've been able to help so many with.
Oh, I'd love to. And I'm going to roll back springboard off of that statement of looking to find the root cause of people's pain. Because roughly, my background was needing to have a job to pay for family and not wanting to have a lot of debt. And so here you are, a science major in college, and you realize, wait, you have to do something with this. Someone suggested some people go to medical school. And so thanks to a good family friend, Dr. DePriest just dove into that. And thanks to the military, was able to do it free of debt. And got into a specialty called physical medicine rehabilitation, which is essentially a lot of sports, pain medicine, neurology, spinal cord, brain injury, amputee rehab, and was very privileged to get to train after medical school at Walter Reed in Washington, D.C., and then Bethesda, Maryland. And a couple things. One, it's a specialty that's focused on recovery and function, which is actually unusual in medicine. And so you have somebody with a concussion, a brain injury, a spinal cord injury, an amputation. You can't change it. It's happened. At that point, you're really left with well, what do we do for your quality of life? What gets you going? What gets your bladder functioning? What gets your limbs functioning? So it's a heavy relational, heavy goal-oriented focus naturally, but it actually plugged me also through my next duty assignment in Fort Gordon in Augusta, Georgia, with a wonderful clinic where I had the flexibility to really experiment and play around with things, to work with people, and to start using some manual neurological techniques. And so a couple things became quickly obvious. One, this intriguing fact, why can two people have the exact same injury and yet very different outcomes? And so at some point it occurred to me, wait, this person was broken before they were injured. Yeah, they're injured, but that only unmasks something that was already the case. And so you might see someone who lost 2 or 3 limbs doing better physically, emotionally, psychologically, spiritually, pain levels in every aspect than somebody who just lost 1 limb. So there was not a clear correlation between the scope of the injury and someone's outcome. And so then that gets interesting. Somewhere in medical school, some interaction with autonomic nervous system work. You're aware of these things from medical school. You have some education, but it's not practical. You don't know. It's a factoid, but it's nothing you can interact with. I find that until you have a tool to interact with something, knowledge is largely fuzzy. It only is useful when it becomes practical. And so it got practical to me when I realized, oh, at a basic level, there's things that can provoke a positive autonomic state and things that can cause dysregulation. And that knowledge, and then getting into things like the limbic system, some fear reflexes, safety reflexes, brainstem function, got me intrigued working with people with knee pain, back pain, etc. And then with sexual assault victims of, well, what if it's possible to just regulate your system? You're not actually in danger. Oddly, despite the fact that you're outrageously anxious, you've got all these symptoms, all the stuff that happened is actually in the past. You are perfectly safe sitting in my office. So just asking people to start to do some basic safety reflex, nursing reflexes things, and the feedback of, well, I don't have flashbacks anymore. Or was that supposed to help my migraines? Because they're gone. So I started getting excited. I wasn't treating symptoms. It was just people were just better. And even knowing that was possible. And so the hope and the encouragement was these horrific events in people's lives actually can heal with the appropriate knowledge and with the compassion and the courage to meet people where they're at. And so that got me started on my journey, which then meant leaving the military 3 years ago, although it was something I loved dearly, in a population I loved, to have the flexibility to continue to work and develop and serve. And so that's got us to our conversation here today, which I'm looking forward to.
Yeah. It's taking you on that journey, just trying to place that in my mind as you go through it. So you got through medical school, you're in the military, you're at Walter Reed, you're seeing these different cases. What is that like? And when you talked about you finally met Lois Lane, you got into this different mindset of thinking, and you brought up the autonomic nervous system. I really would like you to expand upon that a little bit. Let's lay a little foundational education, because what the heck does that mean is what 90% of people are thinking.
Right. But absolutely.
You talked about really bad traumas, spinal cord injuries that maybe we're talking a lot different than the average person seeing a quality of life pain. So something that goes through my head all the time is that, some of the principles of stoicism, and that so many people every day really, really struggle. But some of the things that we're dealing with a lot of the times are imaginative scenarios in our head that we create. And Seneca has a great quote about that. But it's this idea that the imaginary, or where our mind keeps wandering, or that monkey mind keeps going, is what struggles so many of us all the time, not the reality of where we're at. But what you're talking about is a case that is a lot different than that maybe they can still have more on top of that, or where their mind is going. But the reality is they're up against a really, really hard scenario. And so I think you can explain that a little bit better than almost anyone I can think of being able to deal with that patient population and then be able to deal with those that not only are having their internal anxieties and concerns and worries, but also have been through some very, very painful and life-altering situations, but the ways that we're going to be able to take that just so that they can still have hope going forward and be able to enjoy life. Can you take us through a little bit more, maybe a couple of examples of that experience at Walter Reed?
Absolutely. And I'll take you through those. I wish I knew what I knew now back then, but it was part of the journey too. So I'm very thankful. So basically, even something like you mentioned, all these different adaptive mechanisms, stoicism, philosophical methods, physical methods, meditation, etc. I still say at the end of the day, don't even hold a candle to moving into a situation and to love. And so actually, after all these years, all this experience, knowledge, patience, at the end of the day, I'm like, well, we just need to love that part of your experience. You're like, no, you can't. No, this is simplistic. You've got to. No, I'll show you how. And I'm not talking about avoiding, masking. I'm talking about truly resolving, completely resolved, non-issue. This is fully healed. And so, what does that look like? This looks like moving into a situation as opposed to running, because running doesn't work. You can't run far enough away. You can't mask or cover over these symptoms. You've lost 3 limbs. You've had this happen to you. You've been assaulted. You've been abused your whole life. So someone recently, what does this look like? It was a very simple conversation. I'll have the exact same conversation that we had together. Kanya, wonderful man. And it was, Kanya, let's be entirely clear. Are you safe right now? Just tell me, are you look around? Is anyone trying to hit you, hurt you, do anything to you right now? Like no. I'm sitting here talking on Zoom in my living room. No, I'm fine. So, okay. We're going to do something extremely simple. We're going to I'm going to teach you how to send a clear verbal and action or physiological signal, which is the verbal is very simple. I am, in fact, safe now. No matter how you feel, I am safe now. And the best vagal tone, autonomics, all these things just have to do with safety, love, security, is what babies do when they're born, which is they feel the air moving. So I'm breathing slowly, preferably, rhythmically. And just like I'm sucking on a lemon, these nursing reflexes just create some mouth stimulus. And eventually what happens? I'll swallow. And at that point, I've sent an extremely strong and accurate cognitive, i.e. verbal, and physiological, neurological, dopamine, everything, vagal tone, simple signal to my body. Now, the point is, and this is what occurred to me one day, these moments of, this can't be this simple. Is this really this simple? You're like, but why are we talking about safety? Why am I sitting here and we're even having this conversation over this webcast? Because some people aren't. Oh, so it occurred to me, wait, your issue is not with safety in the present tense. Your issue was with safety in the past tense. Of course you've got anxiety. Somebody tried to kill you. Well, if they had, you wouldn't be here. We wouldn't have this conversation. You are safe. The point is, though, that we are all avoiding, even with all these breathing techniques and yoga and all this other stuff, it still falls prey to the exact same problem, which is running. And so at some point, you have to turn and give into that space, which is why I use that word to love. And so if somebody was rescued from a fire, I would literally hold their face in my hands and say, look at me. I have you and you are safe now. So it's the exact opposite of a shock-inducing or dissociative experience. It's actually a reassociation of that broken part. And as soon as people learn how to do that, they say, I was like, okay, so when did someone hit you? It's like, well, when I was 5. Okay. 5-year-old Kanya, you are safe now. Oh, okay. Feel the air, feel your mouth. Okay, let's go. So he starts going, boom, 5-year-old, 7-year-old, 12, 14, 15, the ear that was yanked, the face that was hit, the back, he just starts naming parts of his body. He is on a roll, absolutely pouring in this love, encouragement, vagal tone. There's no fear. And at each point, it's verbal It's physiological, and it is fundamentally accurate, meaning the actual thing that's needed. Just like you got to get that antibiotic to your lungs if you want to get rid of the pneumonia. You can't hold it in your hand. You have to take it. He's getting it on target to the arm that was broken, to the body that was hurt, to the memory that was traumatized. And that's what I'm talking about when you're talking about actually resolving this stuff, is having the courage and the simplicity to know, are you telling me that all I have to do is literally connect with love, truth, compassion, in this case, outright safety signals? Yes. And when you do that, it will resolve and it will heal. So teaching people to do that is a joy, seeing them not be afraid of things. And that was the experience that I learned about in terms of what is this whole vagal system, autonomic system. And the point is, it's a very powerful system, but even that system cannot be divorced from what people have experienced. And they're never truly better until they can actually name, oh, this is for that soldier who was shot at. Hey, soldier, you are safe now. Not some random person. You, that person whose leg was blown off, you are actually cared about. Your body is actually safe now. When that happens, the whole body starts to come out of this massive fight or flight state, which is critical for healing. Some people are naturally there. Those people who I mentioned earlier were broken before they're injured typically already had problems with this fight or flight or autonomic system before the injury happened, and then it just rocked their world. And now my analogy is, you've seen a cracked windshield, a little hairline fracture. This isn't a cracked windshield. This is no windshield. This is a pile of glass sitting on the ground, and we're trying to figure out how that goes back together. So at that point, we're trying to completely restore or remodel someone's safety autonomic system, and that's where good physiological understanding is extremely helpful.
Yeah, I think we have to unpack all of that, and I think that could take a really long time. So let's get started. The first part of that is we explained the idea of very either physically, but guaranteed emotionally and deep down points in our life that can affect us. And certain people we know in certain situations are going to be affected far more than others. It could be at just the right time, but it unloads a cascade of events that leads to a
huge
point
cascade
where now they, to use your verbiage, would say that they lack the safety or that internal at peace with their current situation. And for some reason, either A, keep trying to replay and relive that moment, or B, make different life choices based on things that occurred in the past. And in that reality, that can go a whole lot of different ways. But you're trying to say, if I'm hearing it right, that we can simplify that. And that doesn't mean to discredit. That doesn't mean to belittle the act. It doesn't mean to take anything away from that at all. But if I held your feet to the fire like I just did, asking you to do in 3 minutes to summarize a incredibly complex and one of the most understood situations that there are, you're saying we could almost boil it down to the deepest part of our being nervous, or that's probably not the right word, but we are craving safety and we do not have it.
That's correct. And that there's only two options. You either have it or you don't. And if you don't, then we're not going to pretend, but we're going to talk about wanting it. That's it. So you either have it, in which case we can roll. We're ready to work. Or you say, you know what? I'm not even right now. But do you want to be? Okay. Then we're going to take action. And I'm going to support you in whatever that action needs to be. That's it. It's that simple. And then we will plug that into the places where it needs to go.
So what has been very popular over the last 15, 20 years, and certain patients have had massive success, is what's called cognitive behavioral therapy, or versions of talk therapy and planning and creating strategies to go through situations. Can you explain maybe the similarities and differences between that for the average person, or even clinicians to understand?
Yeah. Absolutely, yeah. Similarities are going to be that you're recognizing that there's a physical response that causes some discomfort, that's real. Hopefully, you're realizing it's caused by something, i.e., there's a reason. It's not random that person A feels the way they do. I've never met anyone yet, and I've worked with a lot of people who did not have a reason for what they were feeling. There's only peoples that I don't know yet. So there's a reason. It causes physical discomfort. They're trying to use verbal or cognitive structures to provide stability and hoping the body kind of naturally falls into place. Sometimes it does, in which case you can have a lot of success. Sometimes it doesn't. They're also mostly future focused, meaning what are you going to do next time? And they can have the same dangers, which is fundamentally not confronting the one glaringly obvious reason that this person, like someone said the other day, he's like, I seem to have this startle response since my car accident to loud noises. I mean, we can talk about this or strategies to deal with noise, but the glaringly obvious fact is that the most likely explanation is there was a loud noise when you had the car accident. Like, it's not complicated, people. The reason you don't like to be touched is someone touched you in a way that was hurtful. It's not complicated. The reason you don't like loud noises is not because of firecrackers. It's because of bombs. Let's be real here. Because someone was shouting and yelling at you, because a gun went off and you thought you're going to, so it's not actually that complicated. Oddly enough, even the conversations we have with patients, with professionals, are very strange because they miss the utter simplicity. The item is its own explanation. The reason you're scared of dogs is because a dog scared you. Oh, right. Okay. So we can, even in all of our elegance, we can miss the glaringly obvious fact and still clinically avoid the one most important thing, which is to solve, which is the reason you're hurt in the first place. It's like having a broken bone and talking about your ankle. It's your arm that's broken. So cognitive behavior therapy can fall prey to the exact same problem, which is having the physiological and moral courage to confront the obvious fact and being able to handle it. Now, the other danger is that it does not have necessarily physical tools. So I think that if you coupled even basic cognitive behavioral therapy with some just extremely simple vagal maneuvers, so there's things that provide, this isn't just a mental issue. Some people say, I know I'm safe. That's not the issue. I know I am. The issue is I don't feel safe. So they're communicating to you that it's a physical issue. It's not a mental issue. They have no mental confusion whatsoever. So they don't need cognitive therapy. They actually need some vagal tone. When that happens, they'll often say, oh, great, I'm good now. That's all I needed. That's what I was attempting to ask for. So cognitive behavioral therapy has some excellent qualities. It understands there's a mental aspect. Its gaps are going to be a lack of physiological capacity. So you got to be able to signal the body. Remember, I said verbally or cognitively, but also physically at the same time. And it can fail to confront and give the verbal signal to the right part, meaning the issue is not that you and I are safe. Jason, here we are having our drinks. Of course we are. The issue is that you or I might not have been at some other time in our life. So if we're going to talk about I'm safe, it would be a lot better to talk about David who almost drowned. Hey, you're safe. Or Jason who had that ankle injury. You're safe. So we better get accurate about where this whole safety thing belongs. And it belongs in the one spot it was lacking in your or my life or in a patient's life that we're seeing. So tell me if that at all started to answer your question or where we need to elaborate on that at all.
Yeah, I think it starts to. So to say that back, it's that when there is someone that is going through something that is obvious, maybe they have a startle reflex or there's something that makes them uncomfortable, that their heart rate goes uncontrollably up in the 90s, 100 when they're sitting. There are very real scenarios that occurred in that individual's life, most likely, that are, even though they can be very aware that right now I'm fine, for some individuals, there are times that they were not fine, but for some reason that keeps coming back to them either subconsciously or without their purpose to bring that forward. But that keeps resonating in their life over and over again.
That's right. You described it perfectly, and it's very simple. It was an overwhelming experience at the time. And so that could literally just be I broke my arm, and the degree of pain neurologically overwhelmed my ability to process. And so literally just the sensory act of touching my arm, I know I'm fine. And yet I still have a physical response because there's an unprocessed sensory experience. And I'm telling you, I have no plan to break your arm, so I'm not a threat to you. The issue is not now. The issue is not that I'm touching you. The issue is an old, unprocessed sensory item, not a current one. And so actually we have to say, hey, Jason's arm from 14 years ago, you are the one who is safe now. And we better get our breathing right, or otherwise, if I say safety, but I'm hyperventilating, I am sending you a mixed physiological signal because my cognitive signal is safety, but my physiological signal is threat, and the body doesn't really understand that. So I must breathe appropriately and send that verbal signal. When I do, that's when that physical, unconscious reflex will subside and resolve.
Yeah, so there's a lot of big words there, and I want to make sure that let's set the tone with a story. If there's one, you can obviously take out names, etc. But can you set that up a little bit better so that more individuals can understand what does that really mean? What does this look like for a person that is dealing with this? As opposed to, I smacked my elbow really hard. Now I've got a bone bruise, and now I'm working through that, exercising it, and it's going to be fine. But we're talking about different cases where in different aspects of their life, there's something that either them or a loved one is aware that is affecting them. And they may not even know that they're making a million decisions based on this. But can you give me a really good story about a case like this that will help tell all of this information, but in a practical,
example
sense? Yeah, it'd be great.
Yeah. So I'm going to give you two examples. One's going to be emotional, and one's going to be physical. Okay. And they'll both be actually the exact same. And people need to realize, oh, it's the same. It's just both a shock level event. So I had possibly a concussion involving the back of my head. Okay. So at that point, maybe or maybe not, I'm having symptoms. Maybe or maybe not, I have issues. For some reason, I think, does that matter? It's real easy. I'm going to remember it. It feels fragmented. I feel scared. I'm getting a little lightheaded. I'm getting a headache. I'd rather not talk. It's hard to focus. Okay.
So we're talking about someone that's had a concussion, and now we're several weeks out and still having
weeks out.
Got it. Okay. So
still having
had a concussion,
issues.
had a head injury, and
several weeks
persistent
and out, maybe several years out.
Gotcha.
But they know ever since that happened, I've had issues. So at that point, the question is anyone hitting your head right now? They're like, no, I'm not. Okay. So I'm not having a concussion right now, but I did have one. Okay. So I just say, okay, and I'll walk through as if I'm them. Okay. I'm safe now. I'm safe now. Okay. And I'm going to do those nursing reflexes. I feel the air in my nose. I'm feeling my mouth.
So talk through that.
Safe.
Why would that be helpful at all? What is a nursing reflex? What does that do to the body? What makes, because that's going to seem to a lot of people like, what the heck are we doing? Like, what do you mean? What's the solution here? Because I think the idea is at first is, okay, I've got this post-concussive symptoms, but it's way longer than they should have resolved. Like this should have been gone by now.
Correct. Should have been gone a long time ago.
Or places where they're still tender on their head, even though it's so much past the natural time that it takes for the nerve cells, et cetera, to recover. But they're still hanging on to this persistent pain. In this case that you're talking about, if you're having a conversation and then we fast forward through the long history, et cetera, that you go through with them, but now you're getting to this point where you're asking them to do what sounds like these reflexes that are like, what? So can you explain
Why?
that a little bit?
Yeah.
Because you said a couple words like
I can.
vagal, etc. And if you can
Vagal.
just tie those knots
Explain
together.
those. Okay. So there's a system in your brain responsible for communicating physical safety. Okay. So it has that function. Just like there's a system to tell you run. When you're injured, you want to be able to run. So to do that, your body revs up. We commonly call that a fight or flight response, or terms like limbic, but it'll just say rev up the system to protect you. So you're going to breathe rapidly. You'll often be mouth breathing. And if you have any bleeding, you're mouth breathing because it constricts blood vessels. So that reduces your risk of dying, which is a big risk.
Important
Or in a head injury, hemorrhage, don't want to happen. Hemorrhage brain, don't want to happen. So it's actually not a bad thing. If you're having a surgery, orthopedic surgery, they'll put a tourniquet on. It doesn't kill you. It's great. You can last for hours so you don't have excessive blood loss. But if you forget to take off the tourniquet when the surgery's over, what happens? You lose the limb because you don't survive without oxygen. So survival mechanisms, wonderful in the short run, very problematic if they're chronic. And they're basically cutting off blood flow to an area. So let's just say that if I breathe fast, I'm stimulating my body, getting ready to fight, run, or cut off blood flow if needed so I don't die. Now, you had your concussion. This was great in the short run. But the problem is, if the brain doesn't have oxygen, it doesn't recover particularly well. So that strategy that worked extremely well in the acute phase causes problems if it doesn't automatically revert back to default settings. And in someone who had a bad concussion or someone who had previous problems, previous fight or flight, it might not revert to default, which is here we are. I'm okay.
Why would that happen?
I'm calm.
Protectively?
So it's important to realize we're not fighting against we have to be aware as clinicians that these are protective reflexes. So respect them. So if someone's still bleeding, I'm not going to tell them to slow their breathing because they need to breathe fast to stop bleeding. Once I have stopped their bleeding, then it's appropriate to slow down. If you and I are getting chased by a bear, I'm not going to sit there saying, hey, Jason, let's slow down and take a meditative moment to do some nursing reflexes and remember that we're safe now. We'll get eaten. That would be idiotic. The point is, let's get away. But once we're away, if I see you're still panicking or you see I'm still panicking, I'm panting, I'm out of control, I'm losing it. Like, hey, David, slow down there. We're here. You're safe now. Now, I'd have you switch over to nasal breathing. And the reason I said slow breathing is fast mouth breathing blows off your carbon dioxide. When you do that, blood vessels constrict. It's a survival thing. It's great. But now we need to build up carbon dioxide to stop those spasms, to restore blood flow to the cells. So that lovely oxygen in your blood doesn't stay in your blood. It gets to the cells and the tissue that need it. And so these people with concussions that aren't resolving, there's an excellent study from University of Buffalo. I believe personally that the major mechanism is blood vessel spasms caused by low carbon dioxide, which is oddly enough essentially meant to be protective in nature, gone awry. So at that point when I say, oh, so why are we doing this? The point is that we must signal your body cognitively and physically, I am safe. And a way to do that is slow your breathing. The best pace is around 6 to 10 breaths per minute. Nose only. Oxygen, carbon dioxide build, and that oxygen being present sends an extremely strong signal to the part of your brain that says, oh, yes, in fact, I am. So think of it like if a lightning bolt blows out a fuse on the breaker box, I need to make sure it flips back on.
Sure.
So that is the activity that we're doing. And so the function is to say, I am safe, but my body is physically getting that signal. And that's where people then say, oh, is that the reason I'm doing these nursing reflexes? Absolutely. And when that part kicks in, that is why we use these terms like autonomic. But for everyday person, I'm just talking fight or flight response. It's like the all clear signal that says, everybody back, the building is clear, the fire is out, you can come home now. And if you never say come home now, it doesn't happen.
So Dr. Dragland just asked, when you were talking about that concussion example, is that a days thing, a weeks thing, a year's thing? How long can that happen as far as when you talked about those individuals with the blood flow switch and the breathing? How long, what's an example of the worst case scenario there?
Yeah. Worst case scenario is you're going to die with symptoms that are unresolved. The worst case scenario is not from the concussion. Worst case scenario is that you will have a chronic fight or flight issue coupled with low carbon dioxide and therefore low oxygen that will eventually cause a slew of chronic health issues, migraines, fibromyalgia, chronic pain, inflammatory autoimmune issues, cancer, and eventually at some point something just kills you. But you die with lots of health problems. Best case scenario, you are naturally resilient. Your body is already programmed for these things to sort of autocorrect. And you're the person that you never think about it. You're like, oh yeah, I guess I had that. And I just recovered naturally. But that person is not rapidly breathing. They're not mouth breathing. They have a normal basal rate. And if you checked everything would check out.
No, I think that's great, because a perfect example of that is that we do see a lot of individuals that have been through some really traumatic things. And, I see a lot of Vietnam War vets, and my grandfather's Korean War vet, and he has some horrific stories. And it wasn't until just a couple years ago that he shared some of those with me. And it shook me so hard just going through those stories myself. And my heart rate is up exponentially. I'm emotional. He's, borderline emotional. And I just asked him, and I go, Gramps, we see so many Vietnam War vets that are just not okay, and they didn't cope well.
That's right.
And even in my family, my uncle, he did not cope well. Some very sad stories there from that Vietnam War era that went through a lot of really terrible things. But I asked Grandpa, I go, hey man, how did you turn out how you did? Successfully raised, great family, worked your butt off. You're late 80s, still on your roofing all the time. Like, Gramps, how did this get here? And he looked at me straight in the eyes and he goes, Jason, when I'm mowing the lawn, you think I'm thinking about things? I'm just mowing. And that was so big to me, because that moment had so much that I learned about mindfulness, et cetera, in the past, is that there's a difference. There's those that are constantly uncontrollably, they keep going back there, or there's a trigger constantly. And then for some, it's not there. So that to me makes a lot of sense what you just said, because that's where my head goes for those experiences. I've seen so many. But how would you explain that, or maybe your experience with those that so many that do well and those that don't? Are there certain patterns that you see with individuals or things to look for?
Yeah. Generally, those people who can cope and can handle it, whether it's resolved or not, meaning whether they have the tools to resolve it fully, are generally people who are very healthy as children. And I mean in every aspect. So they had loving parents. They were cared for, nutritionally and physically healthy. And so they could handle a greater hit and keep going. And there's enough capacity to stay focused, whether it's resolved or not. So even what your grandfather described was wonderful that he was able to do that. That's like when the body walls off an infection. It's not gone. It's just kept at bay, but you can still lead a healthy life. What I'm talking about is a further level, which is you can do that, and that works for some people. It is technically possible to fully resolve that with strong enough antibiotics. And so at that point in the concussion example is to say, I'm safe now, yes, but touch it. I'm going to give a sensory and a cognitive or memory integration. Head, you are safe now. So this is physically where my head was hit. So I don't have a sensory trigger still present. Same thing, slow signal. Now, critical time component. David, who was 8, or was I 12? Whatever it was. David, I am now not running. I'm not hiding. I'm moving into that space. I see you. I want you to know, 8-year-old David, you are safe now. Your body is safe. Swallow kicks in. I feel comfortable. That memory is fully integrated. I have no issues right now. My heart rate is steady. I'm not avoiding. I remember it. And it's a memory. So it's not an unprocessed, relived experience anymore. It is now fully processed, resolved. And so that's the concept where I'm saying we're going to give a sensory integration. In an emotional example, perhaps it wasn't a physical impact to the head. Maybe that was an emotional impact of someone saying, you are worthless. And I say, no, 8-year-old David, that's not true. You have great value. Look at me. I care about you. You matter. Feel the air, feel my mouth. Whoa. So the point is getting it on target. At that point, whether it's the vitamin D, the oxygen, the sensory aspect, or the emotional aspect, whatever is appropriate, that simply matters for that situation, you get it on target and it will work its magic. And that's when things resolve. And so that would be my attempt to describe an example of taking that vagal tone, take that safety, take that love, but apply it with a sensory bent and apply it within time, which is that which is most important for people to do if they want to fully resolve.
Would you say it's an oversimplification to say that in some way, those that are massively affected by certain pain points in their life in the past, there's some level of just avoidance or not acceptance? Would you boil it down to that, or is that inappropriate?
Yes. No, that's completely appropriate. And the point is that you don't ask someone to go there before preparing them. So the odd thing is I'm not going to say, tell me all about all the worst things in your life, et cetera. They're not ready for it. Before I send someone out in the field, I want to make sure they're prepared. So before I even go there, I want to make sure that they understand I'm going to equip you to handle this. And that's going to be very simple. You're going to give love and safety signals to times in your life when they were needed. So let's practice. Let's put some layups in the basket. Are you safe now? So they practice maybe after a week, 2 weeks, 3 weeks. Oh yeah, I broke my arm. Hey, it hurts, but it's not life-shattering event. Let's practice with that. We work on it and they're like, wait, does this work for that other stuff? Yeah, it does. Is it different? It's not different. It's just bigger, but it's not different. So the point is, I'm not even going to go there without their confidence level being high enough that, I'm not running. I am ready. I'm going to mentally, emotionally, physically turn around and I'm ready to go. And I'm going to be there if they need it to help them. So, but you're completely right. It is actually that simple. And the evidence scientifically is fully there to support this, that even the medical community is prone to this fear or lack of confidence. You experienced it with your grandfather. My grandfather was also in the Korean War. And it was years before he even mentioned anything about what it was like. You weren't even there, and your heart rate's racing just hearing him talk about it, right?
Absolutely.
So this is 40 years removed, secondary experience, and it's still that overwhelming to your system. Imagine how it is for him. You're like, wow,
Absolutely.
This is it's got to be crazy. So the point is that that professionals themselves have to be aware that we ourselves, our own physical capacity, moral, emotional capacity, if it's not high enough, we'll just casually sidestep all of these things because we're like, I don't know if I can even handle this conversation. And so there is this element. There's this amazing man, Dr. Folletti, he thought people would be excited. He discovered, hey, he just asked people, and it turns out if they've had these things in their life, like violence, threat, and loss, they're at a 400% increased risk of this, or they're going to have cancer and autoimmune disease and this, and 6 times more likely to attempt suicide. People are going to be excited. This is amazing. If you even just ask them, literally, this is brilliant. He said, if we ask them if these things happen, we didn't even do anything. We just asked. There was a 30% reduction in doctor's visits the next year simply by asking a fellow human being, hey, what's your life been like? Wow. And yet, crickets, absolutely no traction in terms of, well, that's not comfortable to talk about the fact that people have been to war, that grandfathers, uncles, brothers, people have experienced and seen people die. I don't want to talk about that. I don't want to talk about that women and men are sexually trafficked. I don't want to talk about the fact that children are abused in our own culture, that pornography involves sexual abuse imagery of children. That's not comfortable. It's not, but it's real. And if we can't go there, then, as you mentioned, I want to find the root cause of your pain. Well, let me just tell you and anyone straight up, 80 to 90% of people's autonomic fight or flight issues are related to violence, threat, or loss, or death or near-death experiences to their body, physical, or relationships, emotional, like divorce, abandonment, betrayal, or sexual, or spiritual, some sort of betrayal, abandonment, evil that happened there. That's it. If you want to be entirely honest, that's what we're dealing with. So it took me years to get to the point where I could make myself that basic statement. Let's just be honest about it. 80 to 90% of you, this is what you're dealing with. The other 10% might have some environmental issues or a big physical injury or concussion or, infection or, 10 to 20% there, 80 or 90%. Sexual, physical, or emotional. It's a big number. That's the reality of it. And it took me years, medical school, Walter Reed, all of these things, and working with people and working with myself to be able to confront that basic reality because my own body was so revved up just thinking about it.
Well, David, that's unbelievable.
Yeah, that's it.
I think that's it. Is definitely the word. We went over by about 20 minutes, and I couldn't stop you if I had to because I think that sets the stage for the next time we have you on. So good, brother. We have so much to do in this space, and to be able to educate those that go through these experiences so much and don't know where to start or where to go or how to handle it. And I just think that your expertise on that and your take and your experiences together are so unique. And I just can't wait for the world to hear more of those. And I thank you so much for those patients that you've helped in the Nashville community and everywhere else around the country. Thank you so much. And we have literally a topic list that we put together, you and I, that was 15 long. We got through topic number 1 of 15 tonight. But man, I can't thank you enough. So I want to say cheers to you, Dave. Thank you so much for coming on. I can't wait to set the dates, have you on for season 2. Cheers, brother.
Jason, this wouldn't have happened if you hadn't asked and made the space for it. So I honor that in you, and thank you for the time.
You're the man. Talk to you soon, brother. Have a great night.
Okay.